This opioid epidemic is a crisis for everybody in this room and everybody in our counties, our state, and across the country. So I think the interest in the diverse group here is testament to that. And I think the other thing, when I look at the group of people in the room and know that Partners is working with everybody here on different levels around this topic, is we know that the solution is going to come from a diverse group of people. It's going to take all of us working together, sharing resources, sharing information, sharing ideas, and sticking with it together in order to solve this problem.
Well, thank you, Rhett, and thank you, fellow panel members. I look forward to this discussion. We are in a crisis. 12,000 deaths since 1999. When you have that conversation with a mom who has lost a child to an overdose, you feel the tragedy.
And we're talking moving from 2,000 overdose deaths to 2,500 overdose deaths this year. So it really is an epidemic.
My involvement has been at that level of putting together a law enforcement assisted diversion program. And Partners has been instrumental in providing the foundation of the service provider piece for that program, which without that part, you can't have a diversion program.
Well, as the police chief in Gaston County, I've had several opportunities to work with Partners in addressing not only mental health issues, but drug-related issues within the community. They step up to the plate, whether it's lending their expertise, their personnel to help us, whether it's in training, or whether it's holding a summit, or whether it's just funding some PR materials, things of that nature. They're always willing to partner with us. They partner with everybody to make our community a better place to work, live, and play.
We know that our economy is being affected by this, our health, and we know that people's lives, too many have been lost, and too many families are struggling. We know that particularly in North Carolina and in this area of the state, we are facing a very difficult situation.
All the programs we work with, the more local, the better. Just having the ability to affect those things for the people who need the help. And there are a lot of people out there. Partners gives us that connection.
And research shows, and if you look at this issue, you know that when a person who is struggling with addiction is connected to services, the likelihood that they will be involved in criminal activity just plummets. And by partnering with agencies like Partners and the other agencies involved in this program, we feel like we can take these individuals that maybe have gone in and out of the system, and you can't arrest your way out of this problem, we've learned. Then we can put them in a program that hopefully can offer them some real help.
It's going to take all of us working together, sharing resources, sharing information, sharing ideas, and sticking with it together in order to solve this problem.
I am one of 85 health directors in the state of North Carolina. So when we are at association meetings and we are talking about our work with the opioid epidemic, and I start talking about what Partners is doing in Iredell County and their other counties, they are amazed. Some have received no financial assistance, no Narcan, nothing is going on. They're not seeing that reinvestment back into the community, and they are just so surprised that that is something that an LME would do.
That's where it all comes together. It's one thing to talk about it. It's another thing to go out and do and make a difference. Partners does that in Gaston County. I know, I've seen it happen. I've been there with them. I've seen them at the table. And again, I can call them and ask for assistance or expertise, and they will bring it.
We want to continue to work with our law enforcement and our mental health providers, our community groups, our re-entry efforts to make sure that we hit this thing head on. It's going to require nothing less. So I'm grateful for the opportunity to be here and to be a part of this and to hear what I've heard. I learn something new every day on this issue, and I'm grateful for the opportunity. I hope those of you in the audience will take some things that you've learned and back to your various local governments and various communities and work to help implement some of these ideas.